Hello, welcome back. Today we're going to talk about how you can reduce your risk of having a stroke. This session is all about becoming stroke smart, understanding what puts you at risk, spotting the warning signs, and knowing exactly what to do if you or someone else is showing symptoms of a stroke. Remember, you can pause this video at any time to write down your questions. You can use your workbook as a place to record your questions and then the answers when you have your follow-up call at the end of this presentation. Let's start with a few keywords that you will hear during today's presentation. Stroke risk. That means the likelihood of having a stroke. Stroke smart. Being able to recognize the signs of a stroke and to act fast. Heart health. That refers to the overall well-being and condition of your heart. In our first session, we introduced you to Be Fast as a helpful way to remember stroke symptoms. It is so important that we're practicing what it means again. Be fast stands for B, balance. Is a person's balance off? E, for eyes. Is a person having sudden trouble seeing in one or both of their eyes? F stands for face. Check if one side of the face is drooping. A, for arms. See if one arm is weak or numb. S stands for speech. Listen for slurred speech. And T stands for time. If you notice any of these signs, call 911 immediately. Acting quickly can save lives. Becoming stroke smart means reducing your risk, recognizing symptoms early, and responding right away. Now, why should you think about changing your lifestyle habits? It is because once someone has a stroke, their chance of having another one goes up significantly by more than 40% in just 5 years. So changing your habits to prevent a second stroke is really important. We know that change can be hard, but there's some encouraging news. Doctors believe that most second strokes, up to 80% of them, can be prevented by making healthy changes and following medical advice. But what is the best part? The best part is that you get to choose which changes work best for you. Let's take a few minutes to review Stroke Smart. Being stroke smart means 3 important things. First, recognizing the symptoms of a stroke. Second, understanding what increases your risk and how to reduce it. And third, responding quickly if you or someone else shows signs of a stroke by calling 911 immediately. Today we're going to learn about what can raise your risk of having a stroke and ways to lower those risks. We've already talked about common stroke symptoms and reviewed the Be Fast method to help you remember some of them easily. Over the next 2 sessions, we'll work together so you'll feel confident in reducing your stroke risk. So how do you lower your risk of having a stroke? You do that by working with your doctor to manage high blood pressure, cholesterol, diabetes, and having your doctor check you for irregular heartbeats. Also, quitting smoking has a huge impact on stroke risk. We'll look at each of these more closely. So let's review why having high blood pressure is so dangerous. Imagine your blood vessels are like a garden hose. When you turn the water on too high, the hose is under a lot of pressure and could burst if it is not strong enough. Well, high blood pressure works the same way inside of your body. If it's put under too much pressure, your blood vessels cannot handle that and they can burst. This is what causes a stroke, which is a big problem for your brain. So keeping the pressure in the hose just right helps prevent it from bursting, just like controlling your blood pressure helps protect your brain. Good news is that you can keep your blood pressure in check by eating well, staying active, and taking medications if your doctor prescribes them. Regular monitoring of your blood pressure helps catch issues early before they become dangerous. So prevention is key. So let's take a look at why having irregular heartbeats can be dangerous. Another risk factor is atrial fibrillation, or AFib, which causes an irregular heartbeat. This can make blood pool in the heart and form clots that may travel to your brain, causing a stroke. The good news is that AFib can often be treated effectively with medications and other therapies. The next risk factor is high cholesterol. So, what is high cholesterol? It is the buildup of fatty deposits inside of your blood vessels, narrowing them and making it harder for blood to flow properly. We're going to use the hose analogy again. It is like trying to push the same amount of water through a blocked hose. Only a little bit of water comes through, but the pressure on the hose is not good. This blockage increases stroke risk, but can be managed through diet, exercise, and medications. Let's review diabetes and its correlation with strokes. It is important to know that people with diabetes are up to 4 times more likely to have a stroke. Let's look at why that might be and what you can do to prevent this. Diabetes happens when your body can't handle sugar properly because it doesn't make enough insulin. Since sugar is the main fuel your body uses, this can cause some problems. People living with diabetes often have other health issues as well, including high cholesterol, irregular heartbeats, and high blood pressure. Having diabetes is linked to a higher risk of stroke because high blood sugar levels can damage blood vessels over time. When blood vessels are damaged, they're more likely to become narrowed or blocked by fatty deposits. This makes it harder for blood to flow to your brain, increasing the chances of a stroke. So, just like how a clogged pipe can cause water to stop flowing properly, damaged blood vessels can lead to serious problems like strokes. Although having diabetes increases the risk of a stroke, the good news is that you can manage diabetes by losing weight, exercising, eating better, and taking insulin if needed. Managing diabetes well really helps protect your brain and your overall health. Another big risk for stroke is smoking. Did you know that smoking actually doubles your chance of having a stroke? That's because smoking thickens your blood and causes plaque to build up inside your blood vessels, making it harder for blood to flow properly. The good news is that there's a lot of resources to help you quit smoking, like nicotine patches, gum, online programs, and even counseling. Don't hesitate to talk to your doctor about what support might work best for you. Quitting tobacco use can change your life. That is because your heart and brain health are so connected. Stopping smoking lowers your risk just for strokes, but also for heart attacks. And the benefits start quickly. Just 20 minutes after your last cigarette, your blood pressure begins to go down. After 8 hours, your risk of a heart attack starts to drop as well. The great news is that the benefits of quitting keeps growing over time. After just 3 months, your heart can pump blood more easily, which means your body is working. 1 year after quitting, your risk of having a heart attack is cut in half compared to someone who still smokes. And if you stay smoke free for 15 years, your risk goes down so much that it is the same as someone who never smoked at all. So, sticking with it really pays off for your health in the long run. Take a moment to consider this and answer it for yourself. How do you think keeping your heart healthy also protects your brain? Many of the habits we talked about today help both. Now that we understand why it is so important to reduce the risk of having another stroke, let's explore some practical ways you can do that. In this next section, we'll focus on simple but powerful steps like following a healthy diet, staying active, taking your prescribed medications, and limiting alcohol. These actions can make a big difference in protecting your brain and heart health. So let's dive in. Eating a healthy diet after a stroke means aiming for plenty of fruits and vegetables, about 5 to 7 servings a day, and trying to eat the rainbow by choosing a variety of colors. Whole grains like brown rice and barley are a great choice, with about 2 to 4 servings of those daily. Don't forget lean proteins like chicken, beans, or eggs. about 2 servings each day. It is also important to limit salt by checking food labels on packaged items. Here are some tips for making small healthy shifts to your eating. Try to eat breakfast every day and keep the salt shaker off the table to reduce how much salt you consume. Using fresh herbs instead of salt adds flavor without extra sodium. Switching to whole grain breads and pastas give you more fiber, which is great for your heart and brain. Including high fiber foods like beans, nuts, and oily fish in your meals add healthy protein to your diet as well. Let's take a look at healthy eating tips. Cooking with healthier oils like canola, avocado, or olive oil is a simple way to improve your meals. Preparing fruit and veggie snacks ahead of time makes it easier to choose healthy options throughout the day. Being mindful of what you eat by keeping a food diary can help you stay on track. And using smaller plates and bowls is a great trick to control portion sizes. These small habits can really add up to better health over time. Before we move on, take a moment to consider what small changes you tried this week to improve your meals or snacks. Maybe swapping out a salty snack for something fresh or adding extra servings of vegetables. Where can you put your salt shaker so it isn't within arm's reach during meals? Now that we've talked about some great healthy eating tips, you might be wondering where you can get more help or ideas. One really good step is to talk with your doctor about seeing a nutritionist. A nutritionist is someone who can work with you one on one to create a meal plan that fits your needs. There are also lots of online and home resources that make it easier to track what you eat and plan your meals ahead of time. For example, the Healthy Eating Plate from Harvard University and the DASH Diet are both excellent guides to help you eat well and keep your blood pressure in check. Here's a quick overview of DASH. DASH stands for Dietary Approaches to Stop Hypertension. It is a simple way to eat healthier without needing any special or fancy foods. The plan gives you daily and weekly goals for what to eat, helping you keep your blood pressure and cholesterol in check, which are two big factors that affect your heart health. This is something you could talk to your doctor about to see if it is a good fit for you and to get more information. So let's go over why limiting alcohol is vital. Regular drinking can raise your blood pressure, which increases your risk of having another stroke. That is why it is recommended to keep alcohol to 1 drink per day for women and 2 drinks per day for men. Being mindful of these limits help protect your heart and your brain. Now let's talk about physical activities after a stroke. The key is finding activities you enjoy and that feel doable for you. It could be something like walking with a friend or taking dance classes. Even 10 minutes of physical activity can have a positive impact on your heart health. The goal is to aim for about 150 minutes of moderate activity each week. You do not have to do it all at once. Breaking it up into smaller chunks, even just 10 minutes at a time, can make a difference. Whether you prefer doing things on your own or in a group, staying active helps your body and brain stay strong. Just remember to check with your doctor first to make sure the activities are safe for you. Let's go over medications. You may be prescribed medication to prevent a future stroke. It is important to stick to your medication schedule. Following your medication schedules help with maintaining correct medication levels in your body, decreasing your blood pressure levels, pain management, and it improves your brain function. If you aren't sure what medicines do or how to take them, be sure to ask your doctor or pharmacist for clarification. Now let's talk about some medications your doctor might prescribe to help prevent another stroke. Some medicines work by thinning your blood, making it harder for clots to form or grow, like aspirin or warfarin. Others help lower your blood pressure, and there are different types like ACE inhibitors or beta blockers, with names like lisinopril or metoprolol. Let's dive a little deeper into medications your doctors might prescribe. Thrombolytics are powerful drugs that break down clots and are given right after a stroke to help limit damage. Timing is really important here. You would have had these medicines immediately after your stroke. Then there are anticoagulants and antiplatelets, which don't break down clots but help stop new ones from forming over time. These are usually taken long term to keep you safe. Medicines like aspirin and heparin fall into this group. Taking these medications as your doctor directs is really important because they help protect your brain from future problems. Now that we have discussed factors you can change to reduce your stroke risk, let's talk about some factors that you cannot change. Your risk of having a stroke can be different depending on things like your gender and ethnicity. Some groups have unique signs or higher risk, so knowing these can help you spot a stroke early and take steps to lower your chances. Being aware of what makes you personally at risk is a key part of staying healthy and stroke smart. Did you know that each year more women have strokes than men? Women might not always be aware of their unique risk or special symptoms they can experience. Because women often live longer, they're more likely to be alone when a stroke happens and may face tougher recoveries or need long term care. It is really important for women to understand these differences so they can get help quickly and take steps to protect their health. Women can sometimes have different stroke symptoms than men, and these might be less obvious. Besides the common signs, women may experience things like agitation, confusion, hallucinations, sudden weakness, loss of consciousness, pain, sudden changes in behavior, or even seizures. Let's take a look at unique risk factors in women. For example, using oral contraceptives later in life, especially if you smoke or have diabetes or high blood pressure, can increase stroke risk. Pregnancy and hormone replacement therapy during menopause are other times when your risk might be higher. Even migraine headaches can play a role in stroke. Being aware of risk factors help you and your doctor have conversations about how to stay healthy. Now we're going to explore how stroke affects different communities. Research shows that people from different minority groups have a higher chance of having a stroke compared to others. Not only that, but strokes can happen at a younger age and may be more severe in these groups. The good news is that many of the risks, like high blood pressure and diabetes, can be managed or treated no matter your background. So, understanding these risks and taking steps to control them is really important for everyone. Did you know that African Americans are almost twice as likely to have a stroke compared to Caucasians? They're also 2 times more likely to die from a stroke. Unfortunately, strokes tend to happen earlier in life for African Americans as well. This makes it really important to be aware of the risk and take steps to protect your health. Let's take a look at the stroke risk factors that put African Americans at a higher risk of having a stroke. Black Americans are more likely to develop high blood pressure at an early age, finding it harder to control compared to other groups. Another big issue that African Americans face is being overweight or obese, which increases the risk of having a stroke or becoming diabetic. Diabetes is also more common in this group than in non Hispanic whites, adding another layer of risk. A critical part of staying healthy is to exercise. However, less than half of Black adults get the recommended amount of weekly activity, which is important for reducing stroke risk. Lastly, stress is a major issue in this community. African Americans often face daily stresses that can affect their health, such as health conditions like sickle cell anemia, socioeconomic disparities, and a lack of access to health care. The overall importance is to understand these risk factors, learn how to manage them, and make better lifestyle and health decisions, which could decrease your overall risk of having a stroke. Let's take a look at Latino Americans and stroke. Like their African American counterparts, Latino Americans have a higher risk of having a stroke. Cultural factors such as dietary habits can lead to high blood pressure, diabetes, and obesity. They may also have reduced access to healthy food and opportunities to physical activity. There may be disparities to healthcare, such as language barriers and understanding, that can lead to less preventative care, delayed diagnosis, and even a lack of management of stroke risk factors. Did you know stroke and heart disease causes death in 1 in 4 Hispanic men and 1 in 3 Hispanic women? Increasing awareness and education regarding healthy changes and managing medical conditions reduces the risk of strokes in the future. Minority women face the greatest risk of stroke. These women often experience higher rate of stroke compared to others, and it can happen at younger ages too. Because of factors like high blood pressure, diabetes, and other health challenges, their risk is even greater. It is really important for Black women and Latinas to be aware of these risks so they can take action early, like managing health conditions, making healthy lifestyle choices, and getting regular checkups to prevent themselves from a stroke. Here's a short review video to reinforce everything we covered today.
You might not think you're at risk for stroke, but anyone can have a stroke, no matter your age, race, or gender. Stroke can strike at any time. Stroke has a large impact on society, with nearly 7 million stroke survivors in the US. A stroke can cause you to have permanent deficiencies, such as speech, movement, and memory. Let's talk about certain risk factors that you may not realize increase your stroke risk. The good news is that up to 80% of strokes can be prevented. The best way to protect yourself and loved ones from stroke is to understand personal risk and how to manage it. There are two different types of stroke risk factors: controllable and uncontrollable. Controllable risk factors fall into two categories: medical or lifestyle risk factors. Medical risk factors are often caused by a combination of things, including family history. Medical risk factors are treatable by medications and special diets. High blood pressure is the most important risk factor for stroke. It is the force of blood pushing against the walls of the arteries. High blood pressure makes the heart pump harder to move blood through the body. Left untreated, it can lead to stroke as well as heart and kidney disease. Cholesterol, or plaque buildup, is a soft, waxy fat that is made by the body. Cholesterol can also be found in certain foods. High cholesterol can block normal blood flow to the brain and cause a stroke. Atrial fibrillation, or AFib, occurs when the two upper chambers of the heart beat rapidly and unpredictably, producing an irregular heartbeat. AFib raises stroke risk because it allows blood to pool in the heart. When blood pools, it tends to form clots, which can then be carried to the brain, causing a stroke. AFib is a major risk factor for stroke, making someone 5 times more likely to have a stroke. Diabetes is a disease that affects a person's ability to either produce enough insulin or the cells ignore the insulin. Without insulin, the body can't process sugar. People with diabetes are up to 4 times more likely to have a stroke than someone who does not have the disease. Lifestyle risk factors are habits or behaviors people choose to engage in. If they are changed, they can directly affect some medical risk factors by improving them. People who are inactive and seldom exercise are more likely to get a chronic disease or die at an early age. Studies show that people who exercise 5 or more times per week have a reduced stroke risk. Excessive weight puts a strain on the entire circulatory system and can lead to other health problems. According to research, the 2 best ways to lower your risk of stroke is to include fruits and vegetables in your diet and eat smaller portions. Smoking reduces the amount of oxygen in the blood, causing the heart to work harder and allowing blood clots to form more easily. Smoking doubles the risk for stroke when compared to a non-smoker. Drinking too much alcohol can increase blood pressure and the risk of stroke. Aim to drink in moderation, no more than 1 drink a day for women and 2 drinks for men. There are also some uncontrollable risk factors, ones that can't be changed and are simply part of the natural process. Uncontrollable risk factors include age, gender, race, family history, previous stroke or TIA, Fibromuscular dysplasia, a condition where some of the arteries that carry blood throughout the body do not develop as they should, which reduces blood flow. And patent foramen ovale, or PFO, which is a hole in the heart that fails to close after birth. About 1 in 5 Americans have this condition. Remember, the more risk factors you have, the more likely you are to have a stroke. Take control and learn what your personal risk is. Then make the necessary changes to prevent having a stroke. What can you do? Know your health numbers: blood pressure, cholesterol, body mass index, and blood sugar. All can play a key role in your risk for stroke. Work with your healthcare provider to manage these numbers. Stop smoking, set a quit date today, and mark your calendar at home and at work. Enjoy a brisk walk with a friend. Take a dance class or ride a bike. Exercising 5 or more times each week will reduce your risk for stroke. Stock up on citrus fruits, broccoli, and cauliflower. Eating 5 daily servings of fruits and vegetables has been shown to reduce stroke risk by 30%. No matter what, it's important to know what to look for in case of stroke. Use FAST to remember the warning signs of stroke. F is for face. Does one side of the face droop? A is for arms. Does one arm drift downwards? S is for speech. Is their speech slurred or strange? T is for time. If you observe any of these signs, call 911 immediately. Arm yourself with knowledge to prevent stroke happening to you or your loved one. Learn more at stroke.org/risk factors and mendedhearts.org/education.
To wrap things up, remember that some group of people have a higher risk of stroke than others. But the good news is, many of the risk factors we talked about today can be lowered by making changes in how you live. Whether it's quitting smoking, eating healthier, staying active, or managing conditions like high blood pressure and diabetes, you have the power to reduce your risk. The important thing is that anyone can choose to make these changes at any time. So, what are some of the things we've learned today that can help lower stroke risk? In just a few moments, you will have your follow up telehealth call. Be ready to share 1 or 2 things you learned today that you feel ready to try or change. Sharing your thoughts can help you stay motivated. Let's keep working together to stay stroke smart.